My project is on Crohn's disease. Symptoms of Crohn's disease can include diarrhea, fever, fatigue, abdominal pain or cramping, a reduced appetite, weight loss, or anemia. The abdominal pain people with Crohn's disease experience is a sharp pain in the parts of their body where it is inflamed. Crohn's disease and anemia cause fatigue, and weight loss can be due to a reduced appetite. With Crohn's disease, eating can be incredibly painful, which makes it harder to eat. Diagnosis. A way to diagnose Crohn's disease is by doing blood tests, a colonoscopy, an endoscopy, biopsies, a CT scan, an MRI, or an MRE. There are approximately 33,000 new cases of Crohn's disease each year. An MRE is a scan that uses contrast material to produce detailed images of the small intestine and bowel. A colonoscopy is a procedure in which a flexible fiber optic instrument is inserted through the anus in order to examine the colon. An endoscopy is a procedure in which an instrument is introduced through the mouth into the body to give a view of the esophagus, stomach, and upper part of the small intestine. There isn't one test for Crohn's disease, so doctors will use a combination of tests to determine if a person has Crohn's. Blood tests can be done to test for anemia or infections. A colonoscopy is done to see if there are clusters of granulomas or inflammation in the body. If present, this helps to confirm Crohn's disease. With the endoscopy and colonoscopy, parts of the body can be so inflamed that the scope isn't able to fit through them. CT scans, MRIs, and MREs give images of the colon, small intestine, and other organs. These are done to see if there is inflammation in those organs. Risk factors. Some risk factors of Crohn's disease are a family history of Crohn's disease, smoking, exposure to antibiotics, age, anti-inflammatory medications, or diet. Smoking not only increases the risk of contracting Crohn's disease, but those who smoke with Crohn's disease increase their chance of needing more medications and multiple repeated surgeries. Crohn's disease can occur in people at any age, but it is most likely to develop in people under the age of 30. Ibuprofen, Advil, Motrin, Aleve, and others don't cause Crohn's disease, but they can lead to inflammation, which makes the disease worse. A diet high in fat or refined foods may also lead to Crohn's disease. Normal physiology of organ system. Parts of the digestive system are ingestion, mechanical digestion, chemical digestion, propulsion, absorption, and elimination. The digestive system breaks down food into the smallest components. It breaks down food so the body can absorb nutrients. There are 6 essential activities of the digestive system. For some parts of the digestive system is the esophagus, which moves food down into the stomach. The stomach then converts the bolus of food into chyme, and then the chyme goes to the small intestine. The small intestine has 3 segments: the duodenum, jejunum, and ileum. The small intestine completes digestion and absorbs nutrients. The large intestine then absorbs the leftover water, electrolytes, and other nutrients. The large intestine also passes waste products out of the body. 3 sections of the large intestine are the cecum, colon, and rectum. Physiological changes in the organ system. Crohn's can affect any part of the digestive tract, and affected areas have trouble taking in nutrients properly. It affects the way you digest food and get rid of waste. The body's immune system attacks and damages your bowel and gastrointestinal system. The large intestine, which the main part of that is the colon, and the small intestine are usually the areas most affected in people with Crohn's disease. These areas become inflamed and damaged, which makes digestion and taking in nutrients much more difficult. Sore areas can appear all the way through the digestive tract, from the esophagus to the anus. The body's defense system is supposed to fight damaged or virus-infected cells. But Crohn's disease is an autoimmune disease, which means the body's defense mechanism attacks the good cells, which results in the swelling and inflammation of organs in the gastrointestinal system. Eventually, the walls of the affected areas get weak and scarred, and the longer the disease goes without treatment, the more damage done to the organs. In the esophagus and other digestive organs, it becomes harder for the food to get by because of the inflammation and swelling, which this can cause even more problems. Therapeutic intervention and treatment. There are different cases of Crohn's disease: mild, moderate, and severe. For the mild to moderate cases, anti-inflammatory meds and a low-fiber diet could be used. People could also keep a log of foods that cause flare-ups. For severe cases, there are steroids and surgery. A big treatment for Crohn's disease are infusions, like Remicade. Certain foods can cause a flare-up, so a way to try and keep it under control is to write down the foods you eat and pay attention to when symptoms arise. The course of treatment depends on the severity of the disease. Severe cases of Crohn's could involve many surgeries and medications, while mild cases could just need anti-inflammatory medications. Anti-inflammatory medications are usually the first step in treatment. Anti-inflammatory medication helps to reduce inflammation in the affected areas. In most cases, the small intestine and the colon are highly inflamed places. By maintaining a low-fiber diet, you can reduce the risk of blockages in the small and large intestines. Corticosteroids are used in serious cases and are usually used when all other anti-inflammatory drugs haven't been working. Antibiotics may also be used to reduce the amount of drainage and harmful bacteria in the intestines. Severe cases of Crohn's disease can mean surgery. In surgery, the doctor will remove the damaged parts of the digestive tract and try to reconnect the healthier portions. Benefits from surgery are usually temporary, which means they might have to have the surgery again in the future. Steroids are used to reduce the inflammation so there is less pain. Remicade fights a protein that is in the intestines, which tries to stop the inflammation and tries to get the person into remission. Remicade is infused into the body through an IV, and this process usually takes about 3 hours. Advantages of Remicade is that it treats autoimmune diseases by relieving pain and reducing inflammation. Some disadvantages of Remicade are fatigue, weakness, dizziness, chills, and chest pain.